After putting her career on hold because of the impact of Graves' disease, Mercedes decided to have surgery. Now, she had to learn how to live life without a thyroid and learn how to make the necessary adjustments. So, Mercedes, let's look at that. Oh, after that lovely time dropping you off at the
Yeah.
hospital in 2020
Yeah.
during COVID and having to deal with that and not being with you, then the recovery process.
Yeah.
What did that look like for you? How did you feel about that? Were there any unexpected symptoms that happened?
So they expect that there's a risk of damage to any vocal cords and nerves around there because it's such a delicate area and there's so much going on in your neck. Um, there's a risk for slight vocal damage. So what happened is obviously recovered, but my pitch got a little high.
And raspy.
And raspy.
I loved it. Yes.
So my sister lovingly told me I sounded like an Ewok. So that was an unexpected
But that didn't
result.
last too
No,
long.
it didn't last. It was only probably like a couple weeks at
something like
most. But by the end of the month, I got my voice
Now,
back.
something else that I remember the specialist said that it was very important right after surgery that they had to treat you for your parathyroid to make sure what was
So
that?
that's why I stayed over one full night
Mhm.
after the surgery. They wanted to monitor my parathyroids to make sure that they functioned well and they didn't go into shock.
Okay.
Because if that happened, that I forget the symptoms or the effects, but it would require me to stay longer in the hospital, basically.
So they had to make sure that
Yeah.
everything was still working
I
okay.
got no sleep that night. I got a lot of a lot of blood work, a lot of checks done throughout the night. So
now you have to be on a
As
drug for the
a
rest.
replacement, a thyroid replacement.
And
yeah.
what do you take?
So right now I'm taking 175, but they start you right after surgery at 125.
Okay, so you're giving me a dosage here. So they
Yeah.
start you at what? At a lower amount and build you
A
up,
lower
or
amount.
higher and go down? Which way?
They start you off at a lower amount and then
Okay.
they slowly increase you according to the blood tests that they do in your symptoms.
So I guess the reason for that is because if they give you too much, it's like keeping you at hyperthyroidism.
It's like keeping you at hyperthyroidism, yeah, basically. But that means right after surgery, I'm jettisoned into hypothyroidism to the completely
Yes.
opposite end.
So how was that? How was that?
It
How did you feel?
It sucks. I was very lethargic.
Yeah, those symptoms.
Yeah, you went from so like fatigued but hyper.
And you could eat all day long.
Yeah.
And
so now I have to watch what I eat a lot more. I have to work out to keep my weight at proper levels and stuff like that. Things you did not have to think about as much with hyperthyroidism.
And I think the other thing too, being a woman, it did take a few months or what, close to a year to really find the sweet spot?
Yeah, and my cycle was interrupted as well. I didn't have my cycle for probably about 3 months after the surgery. So it affects everything. The thyroid affects everything.
So besides the physical, how did life change after surgery? Your career, your sport?
I didn't go back to fencing after the fact. Hyperthyroidism caused me to take such a pause and lose so much muscle. I'm basically back to ground zero.
That was the other thing we forgot to say. You really waste away and you're at risk of osteoporosis too because you're just leaching all your nutrients out constantly.
So I never really went back to fencing. As much as I love fencing and maybe one day, I never really went back. And it's taken me a long time to come back to aviation as well because one of COVID and then just getting over my studies with my bachelor's degree.
Right.
And other life events that have happened along the way.
Now we have 20 seconds. So you still use natural health products and what was your overall experience with the medical community?
It could be definitely improved. Definitely improved. Better education, better help with the patient to figure out the best alternatives and treatments rather than just kind of having to self-advocate for every single step of the way. Without you being part of it, it would have been a lot harder.
Well, thanks. Even though hyperthyroidism is less common than hypothyroidism, in general, 1 in 10 people struggle with a thyroid condition of some kind. This often overlooked organ is essential to growth and metabolism and regulates body function. Understanding your own condition, deciding on the right treatment for you, and advocating for care in a timely manner will determine the quality of your life. Thanks for joining us.